Dr. Alejandro, thank you so much for talking to me today. On a personal note, thank you for helping me with a recent injury. Thank you so much to you and your staff as always. But today we're talking about the COVID update. It's mid-August. It seems like there's a lot of momentum for COVID just in general. But can you just explain to us real quick, what do we need to know? What's happening or about to happen? And please tell us your advice.
Good to see you, Rich, up and about. And we're getting, we have some reports that there's been an increase in COVID-19 cases in Nosara area. Some people in Arenales and some other reports from a group of construction workers that work in the San Juanillo Opcional area. So this could potentially be concerning. So it's important for everybody to, at the moment we have 7 active cases. That's probably going to increase due to the testing. Ministerio and Caja are heading this way to look at all the nexus. So this started by people that went out of Nosara and broke their social bubbles and then came back to Nosara and broke them again. And it's going to be passed on from person to person easily. It's important that everybody washes their hands, uses a face mask, stays home as much as possible. If you have people working in your house, make sure, or you're working with some other people, make sure that you're wearing your mask. When you talk to them, make sure that if anybody's sick, they stay home and report this. Remember that COVID hotline is 1322. And it's important not to panic, but also be really aware of what's happening. There's a probability of some random testing done by the government Monday or Tuesday in the Nosara area to just try to determine the reach of this outbreak. If you're feeling anxious or want to get tested before, or just want to go and do the test because you feel like that you want to know, or it's gonna give you some peace of mind. As far as I know, the laboratory in Nicoya, they're doing the test. You need to call them beforehand, and the cost of the test is around 85,000 colones. They will give you an appointment because it needs to be done with a certain procedure and a full protective gear. There's also some other labs in the Guanacaste area that are a little farther, but that's a possibility.
Okay. Is there anything people should be buying, or any materials or anything that you suggest they should prepare for?
I think you should just have your hand sanitizer handy. Make sure that you're taking good care of your face mask. If you're using disposable face masks, that you have enough. But it's not a time for load up on groceries or food. It's just a time of being really aware. Take care of yourself and your family by following the guidelines. Make sure that you ask the people that surround you where they have been. If necessary, maybe just quarantine yourself for a couple of weeks and just wait and see. It's also really important that if you're symptomatic, you report this. And authorities have been noticing a lot of lies when people are interviewed, and then that makes the tracking of the epidemiological nexus of cases more difficult, because people don't want to say that when they went to a party to whoever's house, because that person is going to get into trouble, or it just makes the awareness of the possibility of having COVID real. Right. So people are scared and they don't want to talk about it, and makes the health authorities' job more difficult.
Well, you've been saying this and mentioning it for many months now.
I mean, we're taking a lot of precautions here in the office. We're gonna avoid seeing people that could be suspicious cases, because also the presentation of the symptoms has been all over the place. It's not just fever and cough, but I've talked to a bunch of colleagues and also people from the Nicoya Hospital that just say that, you know, people are coming in with just mild fevers and abdominal pain and end up being COVID positive. So we're actually kind of our screening has been more intense. Our screening has a lot more questions. And if there's a slight possibility, we're probably going to try to switch to virtual consultations. So I hope people don't get mad if they come into the office and, you know, have to answer a lot of questions, or you guys call us and we need to ask a lot of questions. We're also trying to remain pretty safe.
Makes sense. It's been interesting in the community. A couple, like the Ferreteria. So at our hardware store, they had their situation, which you can discuss or not. It's up to you. But it seems like they did a pretty good job of saying, "Hey, here's what happened. Here's what we're up to." And I have respect for that. I thought that was cool. I hope more businesses continue to behave that way.
Yeah, what's important here is that also all the renters and property managers and hotels are actually screening people the best they can, because there's been an important influx of people that are not just visiting, but also that are kind of moving into Nosara for, you know, let's say a midterm period of time, like 2 or 3 months. And it's important that they are screening people properly. If anybody has questions or doubts, or they want us to take a look at their protocols, we are more than glad to do that, because we're also getting a benefit from this, which is a healthy community. Hopefully, well, it kind of just
it makes sense. It makes sense.
Yeah, and it went out of our hands, but there's cases now here in Nosara, and there's probably going to be more cases. But we need to try to remain a strong community, a united community in trying to be, as soon as possible, again, COVID-free.
Alejandro, what advice do you have for us? And what do you see happening in our immediate short term? And what exactly should we do? And what's kind of your summary statement?
My summary statement and my recommendations are pretty much the same. This is the way to fight this off is, you know how. Coughing, sneezing protocol, washing your hands, don't touch your face, stay home, social distancing, social bubbles. That's the only way. Now COVID is into our bubble, so we need to be extra aware of who we're in contact with. And how that interaction goes. There's lives at risk, there's health at risk, and way down the line, there's economy at risk, even at more risk. So my conclusion is pretty much the same as the other podcasts and what we've been hearing for 4.5 months. Try to stay home, wash your hands, keep your social distancing, wear a face mask when you're out in public, be empathic, be responsible, help out your fellow neighbor or friend as much as you can by keeping yourself safe. Any doubts or questions, try to reach out to authorities. Don't wait too long. And if you are sick, even if it's the flu, even if it's whatever, just try to stay home. Okay?
Okay. Thank you very much.
Yeah, man. Take it easy. I'll let you